a serious medical condition that goes beyond an infection.
Most people are not even aware of sepsis and the damage it can cause. Here's CBS 21's Chris Nallen with this week's Doc Talk.
The following segment is sponsored by Geisinger Holy Spirit.
It's not just an infection, it's the body's response to that infection.
Dr. James Leaming is the doctor of emergency medicine at Geisinger Holy Spirit. He notes it's imperative people are more aware of sepsis.
What happens in sepsis is still not clear to researchers, but what happens is the body attacks itself and it causes organ injury.
Sepsis happens when you already have an infection, either in your skin, lungs, urinary tract, or somewhere else in the body.
It causes things like high fever that is not controlled well, altered mental status, and sometimes, unfortunately, it leads to death. And that's the reason we take sepsis very seriously.
Dr. Leaming mentions that prevention is extremely important. If an infection goes untreated or not treated correctly, you're at greater risk.
People that are at risk are commonly over the age of 65, the older population of patients, the under age 2, or the younger population.
Others at risk of developing sepsis include patients with COPD, cancer, diabetes, or people in general who have a weaker immune system.
The most important part is recognition.
The faster you or your loved one gets treatment, the better chances of recovery.
We have to be very robust in our response. This means early and aggressive antibiotic treatment, early and aggressive fluid management, and most likely early and aggressive admission to a hospital.
Now that there is more awareness of sepsis, this is helping people combat it, and researchers continue to do more studies to further understand. For this week's Doc Talk, I'm Chris Nallen.